Hello, welcome to Mada Ayurveda Eye Hospitals, Thiruvananthapuram, Kerala. I am Chief Physician Dr. P.K. Shantakumari of this hospital. Today, let us consider some points about diabetic retinopathy, especially food restrictions. Because so many people are asking me about the food items or what all restrictions should be taken for a retinopathy patient like that. It's a very relevant question because people are confused always. They say, I am a diabetic patient, I am already restricting all the carbohydrate items, all the sugar content items. Now, being a retinopathy patient, what all additional factors are to be considered? So, I am going to discuss something about that. First of all, we have to admit that we are a diabetic patient. So, any food control or food restrictions is given by a diabetologist or your general physician should be followed as long as you are a diabetic patient. Generally, these are mainly some to withdraw carbohydrate rich fat foods and also all sugar contents like that, or they will be limiting to some certain according to the nature of the patient or age of the patient. They will be giving a menu that should be followed, and there will be some other habitual factors also, physical exercise or yoga practice, etc., which is benefit for a diabetic patient. But if you are a retinopathy patient, you have already turned to a retinopathy patient, you have to consider something else. That is what I am going to mention here. Then, what happens in a diabetic patient also withdraws all the sugar contents, and sometimes they will add something else to compensate. That may be sometimes negative for a retinopathy patient. For example, hot and spicy food items. Means too much spicy or masala content food items. That is very dangerous for a retinopathy patient. Because according to Ayurvedic principle, I am talking in viewpoint of a Ayurvedic doctor, and according to these principles, Pitta, that means among the three factors, Vata, Pitta, Kapha, Pitta is a dominant factor in a serious retinopathy patient. So, any factor, whether it is food or other habits, which vitiates Pitta, will be a trigger factor for retinopathy. So, if we are considering them, the first comes hot and spicy food items. Then comes sour tasted food items. For example, various types of pickles. These are highly dangerous, and people are always using these items since they have already withdrawn other tasty food items from their menu. So, that also is very dangerous, never to be taken. Then comes deep fried food items. It doesn't mean that fish or meat, non-veg items, not like that. The method of preparation is the problem. Anything deep fried, whether potato or banana, chips items or anything like that is not good for a retinopathy patient. Okay. So, generally I can say hot and spicy and deep fried items, sour tasted food items, etc. should be avoided from your food as far as possible if you are a retinopathy patient. Then considering about other habitual factors, most of the people will be practicing different types of physical exercise to control their diabetes. So, if you are a retinopathy patient, just avoid any type of body posture in a head down or bend down position. If you are having some these gardening habits or some agriculture activities like that, we have to avoid this posture. You can do anything in a standing position or a sitting position or a supine lying position. Never in a head down or bending down position. This will increase the tendency of hemorrhage or leakages or edema collection. These are the main pathology changes in a retinopathy patient. The vessel changes are mainly these vascular changes, accumulation of fluid and leakages from the blood vessels and penetration into the vitreous humor and developing clots. These are the changes. So these leakages and hemorrhages will be increased by this particular position and high exposure. Then next comes an exposure to bright light or artificial light or any type of light source. This also will make some dilatation of the vessels, or in other words, pitta visheshan. So avoid exposure to bright lights or light source if you are a retinopathy patient, especially in the night to an artificial light. This is a trigger factor for pitta visheshan. So you have to avoid it. Then if there is a fresh hemorrhage, avoid any type of movements to the eyeball. Sometimes they'll be practicing some eyeball exercise just to increase the circulation or to stimulate the nerves like that, may be practicing. But if you are a retinopathy patient, be careful about different types of eyeball movements. At least at the time of, if there is leakages or hemorrhages, give rest to the eyeball. Because in the just thing, if there is a hemorrhage or bleeding anywhere in our body, the first step is to give rest to that particular portion to get it clotted or to suppress the bleeding. That is a condition with the eye also. If there is a bleeding tendency, give rest. And almost, if it is a severe hemorrhage, bed rest with a supine position. That is very important. So, avoid bend down or head down postures and exposure to bright light and artificial light, etc. And focusing on, so many people are focusing on sun to get energy like that. So in a retinopathy patient, if there is hemorrhage or leakages, just control it, just avoid it for at least for the time being. Or consult your doctor before doing anything. Then this work in the night, especially on computer or mobile screens like that, because these are like illuminating screens. So that also will increase pitta. So avoid this also. So if you are doing, keeping all these things in mind, we can protect our eyes. Along with the medicine, this is not only possible for controlling the retinopathy, but these food items and habitual factors should be noticed, should be practiced to avoid the possibility of pitta visheshan and thereby development of retinopathy. And if you are already a retinopathy patient, to control it. Okay, so be careful. Have an eye in your daily menu and your daily habitual factors you are doing daily. Okay, thank you all for listening me. I am Dr. Shantamari from Mada Ayurveda Hospital, Trivandrum.